Distinguished guests, ladies and gentlemen, good afternoon. I would like to begin my talk by thanking Yuanling Christian Hospital for inviting me to take part in the webinar. Today, I would like to give a talk on the implementation of a control strategy for COVID-19 in Changhua County. To the end of this month, there had been 441 confirmed cases and 7 days in Taiwan. And nearly 80% of the case was imported from other country. And 10% cannot be traced to a definite original index case. The case fatality was around 1.6%. There had been more than 70,000 PCR testing. On average, the number of testing for each case was 116. The number of daily testing decreased to around 200 per day recently due to the slowing down of the epidemic. In Taiwan, most of the cases of COVID-19 occurred in urban area and metropolitan city. There were 19 confirmed cases in Changhua County, including 4 locally acquired cases and 1 death. The number of testing for each case in Changhua was 226, apparently higher than the national figure. There were 6 major control strategies for COVID-19 in Taiwan, including border control, surveillance and laboratory diagnosis, control of community transmission, medical system response and preparedness, stockpile and allocation of PPE and other medical supply, health education and fighting disinformation. Instead of reviewing the 6 strategies individually, I would prefer to emphasize certain aspects relevant to the implementation at the local level. In Taiwan, fever screening and inquiry about the history of travel, occupation, contact, and cluster had been a standardized procedure for the health assessment of all arrival passengers. Since February 7, arriving passengers from China, Hong Kong, and Macau had to fill out a novel coronavirus health declaration and were required to be under home quarantine for 40 days. Starting from March 19, in response to global epidemic, foreigners have been prohibited from entering Taiwan, and home quarantine measures have been expanded to include all arriving passengers from all countries. Surveillance and reporting is the first step toward the control of emerging infectious disease. Regarding the surveillance of COVID-19 in Taiwan, there were 4 major target groups, including arrival passenger, contact of confirmed cases, cases with community-acquired pneumonia, and patients with suspected symptoms and TOCC. When passengers arrived at the airport, they had to receive fever screening and TOCC inquiry. If there was a positive finding, they will be transferred to the quarantine center or hospital nearby the airport for PCR testing. Other arrivals with negative finding will be required under home quarantine for 40 days. During this period, the personnel of the Health Bureau will monitor the occurrence of any related symptoms. If there was a positive finding, they will be referred to hospital for PCR testing. Furthermore, for reducing the risk of transmission at a pre-symptomatic or asymptomatic state, we initiate a PCR testing when there were no symptoms at the 3rd day of the quarantine period. This protocol was only conducted at Changhua County. For providing support for those people under quarantine, we set up the Center for COVID-19 Consultation and Support Services to assist for transportation, medical care, and household services, such as settlement for people without residence, meal delivery, garbage collection, and consultation, etc. Many volunteers from non-government organizations also participated in the delivery of services. The photo shows the volunteer of the Tzu Chi Foundation, a Buddhist humanitarian organization, attended the opening ceremony of the center. All confirmed cases of COVID-19 were treated in hospital in Taiwan. Once the contact were identified by contact investigation, they will receive serial RT-PCR testing at the first and the second day of quarantine, regardless with or without symptoms. For contact with negative result, they must be under home quarantine for 14 days. The effectiveness of home quarantine relies on the people's adherence to the requirement. Central government has established an electronic security monitor system. The application of the system was pre-installed in the mobile phone. The photo illustrated the personnel of Changhua Health Bureau. They were sending the mobile phone to people subject to home quarantine, accompanied by the participant. As you know, the symptoms of flu and other respiratory infectious disease are similar to COVID-19, especially in the early stage of the disease. It is difficult for physicians to differentiate this disease. In addition, when misdiagnosed severe cases of COVID-19 were admitted in the hospital, there must be a higher risk of transmission. Thus, for monitoring the potential risk of COVID-19 transmission and to reduce the risk of healthcare association infection, we initiate routine PCR screening for all cases with community-acquired pneumonia when they were encountered in emergency room of hospital. Enhanced community surveillance is targeted at patients with suspected symptoms or positive finding from inquiry of TOCC. They will be tested when referred to emergency room triage station by primary care physician. The successful implementation of the surveillance system, as mentioned previously, depended on the capacity of the laboratory. There were 3 labs responsible for this testing in Changhua County. Regularly achieve more than 300 testing per day. We also set up 10 outdoor triage stations at the emergency room of hospital. The station was distributed evenly so that people in each township could reach the testing service within 10 minutes of driving. There were 2 waves of imported COVID-19 cases in Taiwan. The first wave of passengers was from mainland China, the second mainly from Western countries. The number of testing reached a peak in April, with highest amount of more than 700 per day. Most of the testing was contributed by community-acquired pneumonia and enhanced community surveillance. One of the most characteristic control strategy of Taiwan was the digital contact tracing system. The system combined information and data from electronic health record of national health insurance, closed-circuit television, and geo-position data. The geo-position data were derived from a network-based mobile phone tracking method. The digital contact tracing was further integrated with the conventional contact tracing and become a very powerful tool for effective and comprehensive contact investigation. The implementation of digital contact tracing also heavily relies on a strong collaboration between the Health Bureau and the Police Department. In the video, Commissioner Fang Yangling of Changhua Police Department was explaining the process of digital contact tracing. The slide illustrated the result of combining conventional and digital contact tracing for the contact investigation of the first COVID-19 cases of days in Taiwan. The case was a freelance taxi driver who had acquired COVID-19 from the index case passenger returning from mainland China. We had traced and identified more than 600 cases of family contact, passenger contact, and other social contact within 36 hours. In the beginning of the pandemic, on January, when most of the supply of the medical mask in Taiwan was imported from other countries, according to the experience of SARS outbreak, Taiwan government made a very decisive decision to ban the export of the medical mask and took control of mask distribution from the private sector. Simultaneously, government also invested more than $6 million to purchase new supply lines and recruit a team of about 100 technicians to assemble face mask production line. Prior to the COVID-19 outbreak, Taiwan was capable of producing nearly 2 million masks per day. And now, the daily output has surpassed 13.3 million with the addition of the 19 new mask production unit. There were two channels for the mask distribution. The first, for the frontline healthcare worker and other care provider, medical masks had been distributed directly by local health bureau. The second, for the general public, the government set up a name-based mask rationing system. People could purchase the mask at pharmacy or health center by using the National Health Insurance card. Furthermore, people could also buy the mask through an online ordering mechanism and get a mask from a convenience store such as 7-Eleven or Family Mart. Every citizen is allowed to purchase 9 adult size or 10 child size face masks every 2 weeks. The photo shows people waiting in line for buying masks in front of the health center in Changhua. Although the Central Epidemic Command Center has conducted daily press briefing chaired by the commander to release COVID-19 related information to the public, at local level, we created many infographics to deliver COVID-19 education and prevention practice in an accessible, easy, comprehensive way. These infographics were shared to circulate social media such as the Facebook, Line, and Twitter, etc. Here are 3 examples regarding the hand washing and how to choose and put on a face mask. We also use health education video to deliver the information of COVID-19 prevention and control. In this video, Magistrate Wang Huimei of Changhua County Government was demonstrating what is social distancing and how to keep a distance from others of at least 1.5 meter indoor and 1 meter outdoor. Before coronavirus vaccine or effective antiviral medication are widely accessible, we must prepare for the potential second wave of COVID-19 outbreak. We adopt 5 key strategy plans, including continue active surveillance, maintain preventive measures such as personal hygiene, use of PPE, and social distancing. We are going to conduct several preventive surveys to assess the status of COVID-19 transmission in our community. We also plan to increase the coverage of flu vaccine and pneumococcal polysaccharide vaccines. Finally, since patients with chronic disease have a higher risk of severe morbidity and mortality when attacked by COVID-19, the critical issue is to enhance chronic disease management, especially for the elderly. COVID-19 pandemic is a global health crisis that needs an extraordinary response. The tragedy of this pandemic is having a profound effect on the life of millions of people around the world. Recently, imposed restrictions to daily life have forced us to quickly adopt different ways of working, learning, and connecting with each other. I hope we will find useful information regarding the containment of COVID-19 in this presentation. Thank you for your attention.